decided to.
She's young, very useful is that Professor.
Until now, it's.
Hello, I'm Dr. Pierre Quinaudot. I'm a Swiss National Secretary of ISAPS, and I use 3D implants since a long time for thoracic reconstruction. And I think it's a great technique.
Hello everyone, my name is Professor Christine Redke. I'm the head of the Department for Plastic and Reconstructive Surgery here at the medical school in Vienna. And for the last several years I worked very successfully with the 3D implants for pectus excavatum reconstruction. So we do this work together with the thoracic surgeons and we do secondary cases. It's a procedure where we see the patient, we discuss the options, and after a certain time of preparation, the 3D implant will be printed. The surgery will then take part, and the results are amazing, and I'm very happy about the possibility to have those 3D personalized implants for corrections of pectus excavatum.
My name is Omar Tillo. I'm one of the plastic and reconstructive surgeons practicing in central London and in the United Kingdom. My work is focused on body contouring and body surgery from the head down, using fatty transfer liposuction as well as implants. So overall I have a extremely positive experience using the 3D computer designed implant. In terms of the outcome from the surgery, because those implants are designed based on an actual CT scan of the patient, which kind of showing the muscle and the skeleton, so those, I've seen them, they give the best possible fit to the anatomy of the patient.
David Lamenta. I'm a plastic surgeon working in a public-private setting in Austria. I've been using the technique with a three-dimensional reconstruction for thoracic deformities for some years now. And I think it has a lot of advantages over more invasive things.